All right, got to start with COVID. Another lockdown in the UK. A short time ago, Prime Minister Boris Johnson imposed a third coronavirus lockdown across England, shutting schools and ordering the public to stay at home. It's yet another sign that the virus, 1 year after the first case in China, is not slowing down. Joining us now to discuss the latest developments is Dr. Owais Durrani. Dr. Durrani is an emergency medicine resident physician based in San Antonio, Texas. Dr. Durrani, thank you so much for joining us. Let's talk about what you're seeing, because more people traveled in late December than during Thanksgiving weekend. So are you seeing an increase in cases from the holidays already, or is that still to come?
Thanks for having me. Yeah, we've been seeing essentially a straight rise in cases about a week after Thanksgiving, and there hasn't been any letdown since then. It just seems like, it's almost ridiculous to call it a surge at this point. It's just a continued increase. We're seeing more and more COVID patients in the emergency department, more patients that are getting admitted to the hospital, and we're seeing a lot of emergency department boarding where the hospitals are so full that the patients are having to stay down in the emergency department for long periods of times as well. So unfortunately, we haven't seen the surge from Christmas and potential New Year's gatherings yet. So we are in for a long few months at least.
Yeah, sounds like you and your colleagues are bracing for the surge then. Now that we have multiple vaccines, Dr. Durrani, is knowledge of that changing the way people behave?
I think so. And I think, people are behaving in a way where they think we're at the end of the tunnel, or we've kind of won this battle, and we haven't. All the indicators and numbers that we take a look at are lagging indicators. The other side of that is most people won't get access to a vaccine for a couple of months at least. So right now, the best tools we have are the same tools we've had since the beginning of March, and that's wearing masks, social distancing, and washing your hands. And I think we as a society are starting to get lax on some of those things, and that would lead us to a really, really bad place if we don't really focus on those basics right now.
Yeah, well, whether you wear a mask depends on whether you believe COVID is real. And I know that you've seen a lot of patients who don't quite believe it. It's either not real to them or not a big deal to them. We're 11 months into this pandemic. Has that changed?
I will say it's better than the beginning of March and April, but there are still some out there that don't believe that COVID is real or that wearing a mask is going to help. To them, I say, at worst, it's an annoyance and you wear a mask and it, annoys you for a bit. At best, you don't have to be a police officer or go to medical school or nursing school and save a life. You can simply save a life by wearing a mask. And so that is my message to them. I think coming from a place of wanting to help your fellow countrymen is how we need to approach this, and it is absolutely not a political issue.
I'm really glad to hear that at least there's more traction on people's willingness to wear masks. I know that in looking at your Twitter page, you were an intern for the Obama White House, and you also have a picture of you with President-elect Joe Biden on your Twitter page as well. What do you think is the single most important advice you would give to the incoming Biden administration on how to depoliticize science so that we can contain and reduce this outbreak?
Yeah, I think having our science leaders, our public health officials leading this effort is going to be number one. And so, whether that's Dr. Fauci or a variety of other leaders kind of giving us those facts is where we start. Now, unfortunately, a lot of those individuals have kind of been pulled into the political fray, and it might take some time for them to kind of get out of that and focus on the facts. I think my biggest piece of advice would be once, President-elect Biden is president, every decision he makes is going to be, criticized, and there's going to be poll numbers associated with it and whatnot. I think he needs to continue to focus on the science and what the scientific community says. And there's going to be tough decisions that might not be popular amongst a big portion of the country, but we'll need to make those decisions to make sure that we save the maximum number of lives possible. Yeah,
don't get distracted by the poll numbers and the short-term impact. Of course, when we look at the vaccine, we're seeing racial discrepancies in terms of who is getting it. In North Carolina, for instance, 80% of vaccines have gone to white people versus below 10% for other demographics. Do you think there's a quick way to fix this?
The unfortunate answer is Probably not. What it's going to take is a lot of hard work. As a healthcare system, we have failed minority populations and lower income populations historically for a long, long time. And so that's not something that can be changed over time. What we do need is federal leadership and federal dollars so that we can educate and interact with those communities where they are. So whether that's churches, barbershops, whatever that environment is, and making sure that we engage the leaders from those communities in these efforts so that we are communicating with them through trusted individuals and making sure that they are not left behind as they have been in many of the other kind of areas of healthcare throughout American history.
Dr. Durrani, thank you so much for joining us, and thank you for all the work that you do on the front lines. We really appreciate your taking the time. Dr. Durrani is an emergency medicine resident physician at UT San Antonio.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.